Hello, my name is Zini Manuel, and my proposed policy is intended to address a public health issue called obesity. Obesity can affect all human beings, but my policy will directly affect obesity in children. Childhood obesity has been on the rise by 20% in children ages 6 to 11, and that number is triple for children under the age of 6. This is posing a serious issue with many health and social consequences that may often continue into adulthood. Research on children and obesity is showing that families' eating patterns are crucial factors, and environmental and lifestyle are all contributing factors to obesity. The responsibility for this national epidemic is the question: who is responsible for these children's lifestyle and eating habits, which play all an important role in childhood obesity? One of the first questions to answer is, what is childhood obesity? According to Mayo Clinic Childhood Obesity 2010, childhood obesity is a serious medical condition that affects children and adolescents. It occurs when a child is well above the normal weight for his and her age and height. Generally, consumption of foods high in sugar and fats lead to obesity. According to research, we all have and need fat tissue in our bodies. When there is too much body fat, the result is obesity. There are many factors that contribute to causing obesity, including physical activity, lifestyle, eating habits, environment, family, and genetic inheritance. The greatest impact on a child in their eating and exercise habits comes from their environment. A child that comes from a healthy environment learns good food choices and exercise habits. If a child comes from an environment where food choices and exercise aren't as important, this can lead to obesity. A child that is encouraged to eat healthy and exercise will continue nutritious foods at a reasonable amount and regular physical activity. However, according to a recent survey conducted, most students obtain their junk food from KFC, Pizza Hut, McDonald's, Domino's, Hungry Jack's, or the school cafeteria. My proposed public health policy will be implementing a healthy choice program for schools to follow. The healthy choice program will change the food being served in all school cafeterias, and it will also change the exercise and gym programs in schools. With a major part of a child's day spent in school, you would think that healthy food choices will be an important part of their day. Administrators should help ensure that there are healthy food choices for children. Most schools, there are readily accessible vending machines which consist of very unhealthy foods, such as soda, candy, and chips. The cafeterias, the menu includes French fries and burgers, and may also have a corporate sponsor such as Taco Bell or Pizza Hut. Faced with these different food options, can be very difficult for a child to eat healthy. School cafeterias should offer more beneficial foods, such as salads and sandwiches, to cater to the health of the students. Along with getting healthier food, administrators should help facilitate exercise programs and weight training in their gym classes. Students should also be taught more about fats and cholesterol and how to avoid them in classes. Another obvious factor is inactivity. One aspect of my program will be eliminating all vending machines with unhealthy foods and drinks. Vending foods and drinks. Another major aspect for my program is making sure fruit and veggies are easy to grab in the cafeteria. By simply making fruit and vegetables more attractive can help. Placing fresh fruit in a nice basket next to the cash register will be very effective. Even having the workers in the cafeteria ask the students, "Would you like to try an apple?" can bring down the obesity rates. Another major aspect to my policy will be making sure water is put everywhere in schools. Water should be made as the default choice for students' beverages. There should be fountains placed everywhere, and outside too. The cost of my proposed policy program will be roughly $30,000 a year, and it should replace all unhealthy foods in vending machines and the food that is prepared in the cafeteria. It should also make sure that water is readily available, like having water bottles on demand. It should help when bringing it should also help when bringing more water in the schools and making it more accessible. The risk of enacting this school policy will be helping in reducing the amount of children that are obese, which is a major health challenge in the United States right now. People's lives will change drastically if the policy is enacted. This will be a lifestyle change for children, especially the ones that are always eating unhealthy and don't get a lot of physical activity in on a daily. It will be a challenge, but very, very beneficial in the end. Childhood obesity is now considered to be an epidemic and an ongoing problem in today's society. Research on this is still in the beginning, and 20 years from now, we can hope that their data is to help fight this growing epidemic. Laws have played a critical role in the control of chronic diseases and the behaviors that lead to them. The use of this systematic legal framework, the use of legislation, regulation, and policies are there to address the multiple factors that contribute to this obesity environment. They can also assist in development, implementation, and evaluation of a variety of legal approaches for obesity prevention and control. Policymakers and public health practitioners need to know the best practices and have the competency to use laws and legal authorities to reverse obesity epidemics. For instance, statutes and regulations at the federal, state, and local levels of government have been implemented to improve nutritional choices, to access healthy foods, encourage physical activity, and educate consumers about adopting more healthy lifestyles. Stronger policies are needed to provide healthy needs to students in schools, limit their access to low nutrient, energy dense foods during the school day, and increase the frequency, intensity, and duration of all physical activity during the school day. Thank you very much.